Sup, Charles?
How you doing, brother Mel?
You're live on Facebook right now
I am.
after a little bit of connectivity issues again,
Well, good afternoon.
but
Mm-hmm.
we were able to fix it. So we are live tonight. It is Aloha Friday, everybody.
Yeah,
It's been a
sorry.
long week. It's been a long week. Um, and I don't know. It just seems like we're in for a long haul there, Charles. It looks like we're in for a long haul.
Well, let me say this before you take over. Ladies and gentlemen, I know the crowd is small right now, but if you have this opportunity, start to share. Okay, if you can, start sharing. We have about 40 of you on right now, and 40 of the diehards. Yes, 40 of the diehards that come on every night. I like to share. It's we continue to have this magical ride, and we have to persevere, whether good or bad. But we have to, we've always said that we will bring the information, and then we would give the information to you, and then you can decide if that you can use the information or not. It's not all the time we're going to have great successes. That's why you have to persevere at what you do. And I'm not saying that we're all that, but I know we mean it from the heart. Both Mel and I mean it from the heart that when we're going to bring things to you, it's because we believe you should know these things. And it's not trying to sway you anyway, but it's just to give you an idea and understanding so you can better prepare yourself on how to be safe. Because if we have certain things taken away from us because the state doesn't want to do certain things, it's okay. It's okay. But that doesn't mean that your whole life comes to a stop. You got to keep moving forward. But always saying is you got to keep moving forward safely. Okay. And so, I wanted to say that up front, right at the beginning of the show, and I'll say that at the very end as well. Got to keep ourselves safe. All we have is each other. We stay connected. Today, I had an opportunity to drop off some masks to one of the viewers who needed some masks, and it was my pleasure in doing so. And I'm very, very happy that she's happy because I guess she got her original mask from the Kupuna program, and she needed more. And I was able to meet her on island and drop it off to her, and I'm glad that happens. But that's what it's all about. It's all about staying connected with each other, helping each other out. Whenever you need something, if I can provide, I'll definitely do it. I will never turn my back on any of you. And to my brother Mel, again, last night was one heck of a show. I know my brother thought I was a little bit upset with you. No, I wasn't. I love you too much, Mel. So don't you worry about that. It's just certain things were said that it triggered a thought that I had and some information that I'm privy to. So now I was able to formulate the entire picture and understand why when you get the short end of the stick, uh, oh boy, I like cry now. I just got one notice. My good friend is for years. It just popped up on my screen now. My good friend that so close to my wife and I, he just came down with COVID and he's hospitalized now at Castle Memorial Hospital on Oahu. Prayers out to you, my brother. Okay, you
Well,
know who I'm talking about. Prayers to you. I, oh man. And then the guy's a cancer survivor. He whipped cancer and now whew,
well, well. That's a shitty way to start the show, but we're praying for him. Again, that's what COVID does. COVID is not just this meek, mild virus that affects a few people. I mean, and I'm going to say it again. Our president and his wife has the virus. They both have the virus. Their staff, some of their staff members have the virus. And we're just not going to tolerate any kind of political bashing tonight. Where we should all come together, whether you like the guy, not like the guy, support the guy, not support the guy. The bottom line is, we all belong to this human race, and we all got to pray for people, all people that are sick, whether it's COVID or not. I mean, so just a warning. that if I see any of those comments coming about hoping death or harm on anybody, you're gonna be blocked. Okay. And I hate to be the bad guy, but that's what I got to do because I don't want to detract from our guest tonight. Is Dr. Steve Rogoff from Kilauea, and he's got some information. I have not met him yet, so we're all gonna meet him for the first time. But I did want to say, Charlie, as far as last night, yeah, I love you too, my man, and you hit it on the head, pal. We all we get is each other. I watched
Yep.
the mayor's. Well, we saw the lieutenant governor's press conference yesterday, and he's very excited that the tourists are coming back, and they're doing everything in their power at the state level to make it as convenient and easy for them to come in. We know that. Okay, so let's just accept it for now. We're gonna continue to fight. We are going to continue to fight, but that is the plan, and looks like that's the way it's gonna go. I watched the mayor's press conference today, or his daily or his meeting, and the governor hasn't responded yet to the mayor on a second test for Kauai. He told the mayors that he would get an answer back to them early on when he made that rule where he was going to be God and he had to approve everything, that he was going to get an answer in 24 hours. But it's been a lot longer than that. And as I watched the mayor pleading, basically begging this governor to allow him to make his island safe, and this governor cannot even respond. Well, I'll tell you, I have sources like you, Charlie. We all have sources. My sources tell me this guy's not going to approve it. He's going to deny it. And what a shallow, I'm not going to say it, but why would you not allow your one of the mayors to deal with his or her island as they see fit? Why isn't the governor meeting with all the mayors on a regular basis? I know they meet occasionally, but why are not the mayors in this circle of decision makers that work so hard to get inter-island trans-Pacific travel open? Well, again, my sources tell me what's going on up at the Square building. My sources tell me things that obviously I cannot reveal my source. But what I can do, and what I did today again, is I don't know if you can see this.
Yeah, right there.
This is a UIPA request, a request to access a government record. And I wasn't even going to bring this up tonight, but just, I don't know, my heart is telling me to share this. Anyway, because of what I have learned, and Charlie and I, we've talked about this, we have some mutual sources, some not mutual sources, but our sources both tell us the same thing.
Yeah.
That, obviously, and it's so obvious, right? You get Hawaiian Airlines controlling the flow right now. So anyway, I sent one of these last week. I didn't even get an acknowledgement. I should have sent it certified mail. So today I resent it, and I was very specific. I said I'm requesting the names of all members and stakeholders of all COVID-19 task forces, pre-travel advisory groups, and other informational committees, including but not limited to Laulima Alliance, that report to the governor and the lieutenant governor. They have 10 days from receipt. And this time I was a little more smart, and I made a copy of this too. This is my click and ship USPS. I can do it from home, priority mail, and look at that on the bottom. Signature required. Where does it say that? Oh, right here. Signature required. From the moment that they get this, they have 10 days to respond to me. And if they don't, then we file a complaint with the Office of Information Practice. The reason I bring this up, people, I like you guys to understand that there's a lot of us, it's not just me and Charlie. There's a lot of us out there right now that are fighting really, really hard to make this right. And, I thought by now we would have had everything squared away. The marriage, you can tell I'm shaking because I don't like this kind of nonsense. I don't like when people play games. I don't like when people get advantages over others. I don't like when people call the shots and our own mayor cannot do what he believes is best for, and not only him, the whole damn island thinks is best for us. A couple of naysayers, a few naysayers out there saying that, this is ridiculous. We should let everybody come in. But that's a very small minority. The vast majority of people here are concerned with the surges I mean, I look at Charlie's post, all his information, his data that he's been putting out several times a day. Um, this is not stuff that we make up. This is actual data that we're getting from other places that are going through the same thing. So anyway, I just want you guys to understand that it goes beyond the show. Charlie and I, we speak several times a day. And I'm not saying this to brag or have you guys tell us thank you. That's absolutely not what this is about. This is simply about letting you guys know that we all are in this together. We're either going to win together or we're going to lose together. But let's not give up the fight. Somebody asked me today, oh, Mel, I sent the governor an email. What more can I do? You ask everybody you know to do the same thing. Every time you see a post from Charlie or you see a post from me or you see a request for some activity or action, share it on your page, share it with your friends. That's the only way. That's the only way. And I'm telling you right now, the time is 15th is right around the corner. 15 is right around the corner.
You know what makes it difficult, and I think tonight I'm just gonna be composed. I get so much on my mind, but I want to ask all the viewers out there, if you thought about the time that we had that huge surge and we were filled to capacity, all the hospital beds, you need to ask yourself, how did we get to that point? Okay, how did we get to that point? It's like when somebody like myself have open heart surgery. Just because you got a new lease on life does not mean you go back out there and abuse yourself again that put you into that damn place in the first place. You don't. You change your life. Once God gives you that new lease on life, make the best of it. Okay? Those doctors, they use all their skill and knowledge to give you that new lease so you can live your life with your loved ones. So is with this surge that we had. The capacity is filled up. Now it went back down. I'm just saying, why flirt with danger? And you saw in a couple of my posts, right, Mel? I said, hey, if I'm wrong, tell me where I'm wrong, because there's gotta be a reason why you think the way you do, and I think the way I do, and why many others think the way I do, because we're worried. You put out the information. You said in your conference, the numbers were down. You also said in your conference, but you're ramping up staffing for the hospitals. Why? Why ramp it up if everything is down? It doesn't make sense. What, are you expecting something that the rest of us don't know about? And all I'm saying is, come on. If you care about us, I ain't asking you to feed my family. I ain't asking you to for a handout. All I'm asking you is just for a little decency, so I can make the proper preparations. And if not, that's the reason why I come on every day to tell all of you, we gotta think of ourselves. We gotta help each other, because those who we elected got in office, it seems quite evident that when you ask for the help, for some reason, their line is like the unemployment line. You're gonna have to call about 50 million times before you get through. By then you give up already. So that's why we do what we do.
Yeah. All right. We'll bring in Steve. He's patiently waiting. Thank you, Charlie. And you're right, man. Everything you hit it on the head again. And I did get a response from Senator Donna Mercado Kim today. She said she's the only one that responded. I sent it to a bunch of senators. She's the only one that responded. She was asking if she could come on tonight. I said no, because we had this world famous, world renowned doctor that I refused to bump even for the senator. Yeah. But I did ask her. I did let her know that we would free up tomorrow night for her, so I'm waiting for a response. But anyway, how you doing, Steve?
Hey, how's it going, man? Good to see you, Mel.
That's Charlie up there, the Hawaiian. He's Charlie. I'm Mel.
Good to meet you guys. Pleasure. Thanks for having me on.
Oh man, appreciate. I'm not sure if you've had a chance to watch some of our shows. It gets kind of interesting sometimes, and appreciate you taking the time to join us tonight. We are really talking about COVID. We've been really focusing in on October 15th. We know a lot of people know you as the doctor that wrote that wonderful article or the letter to the editor, to our mayor. That's how I actually got to
Right.
know who you were, and really liked what you wrote. Agreed with it, and so that's where we at. So why don't you introduce yourself? Tell us a little bit about yourself, and then I don't know where this thing is gonna go.
I never know where it's going to go. Steve Rogoff. I've been living here for 18 years. I'm medical director of a clinic up in Kilauea called Halalea. And as that note in that letter thing to the editor said, I've been working on Molokai for as long, 18 years, going over there and covering the ER. And kind of actually from that perspective is kind of where my interest starts. I mean, we're over there in, like a 6-bed hospital. I'm the only doctor around. We don't have surgeons. We don't have ICU. We got one ambulance crew for the whole island. And, right around February, March, when this thing looked like it was coming our way, we were pretty nervous about how something would look like that. Like a car accident with two victims or 3 patients makes, it's a nightmare logistically. I really have to make choices. So I'm used to making choices, and kind of trying to stabilize and use our one ventilator and our one ambulance and our one, fixed wing, could get somebody over to Oahu to stabilize them. So I understand well the kind of limited resources that this island chain has, and Kauai is only slightly better than that, right? I think we have 7 ICU beds, and I don't know, maybe we can scrape together 10 or 15 ventilators. So when it all started in March, I was really nervous, and fortunately, we've staved it off with just the unique part of our island, and that we're isolated. And then this October 15th thing was kind of creeping through, and it just didn't make sense to anybody, I think, at least here on Kauai. And when I wrote that letter, honestly, I just jotted it out in 5 minutes on a day before work, and all it said was, I just don't think a testing policy 72 hours to 0 hours before flight is useful, and I'd like to volunteer to kind of get a crew of people together to test, or I could get a bunch of doctors to sign something, just as long as you're aware, Mayor, that this is where we're at. And it just so happens that, of course, I was blind to all the things happening behind the scenes. There's all kinds of interest groups that have been actually working on this, and I think you've heard from some of the docs, like Mason Chong, or not Mason Chong, but some of the guys like Kapono Chong and stuff that have been kind of involved with this COVID discussion group that had like 6 or 7 MDs and a virologist and infectious disease specialist, and Joanne Yukamura was on this panel, and they came up with some ideas. So it's funny, I just wrote that quick little letter to the mayor, realized it wasn't going to get any traction, called the classified department over at the Garden Island, and I said, look, I got to go to work, but maybe you can help me find the number to get this in. And the woman over there was like, oh my God, thanks so much for doing this, I'll find who you need, and gave me the email and the phone number. And then they put the little, like a 3-paragraph 100-word thing that just says, Mayor Kawakami, you're doing great, let's just kind of not make a mistake here. So that's kind of how I got involved. My background, I went to Berkeley and UC San Diego and San Francisco, moved here in 2002 with my wife, and, really planted our roots here and love this island, and it's our home and it's our community. And we just really want to, above all things, protect what we have. And so too do I see the multiple issues at hand, right? I mean, I see that the tourism runs a lot of this economy. I see friends and people I love in the community are jobless, and I see fear. I see vacation rentals going empty and restaurants going down and businesses closing. So there's clearly a lot of people to think about. But fortunately, my perspective is one of protecting, the health of my patients and the community at large. So for me to write something briefly that said, hey, at least a second test, at least 48 hours beyond their arrival, at least that. And then in preparation for this meeting, I've kind of dove into the numbers, and it's just a matter of, this 14-day thing works great. And, a day zero thing is not going to work at all. And a testing at day 2, or as the mayor thinks now, day 3, that's going to reduce the risk a great deal. And day 4 is even better, and day 5 is even better, and day 6 is kind of looking like kind of a really good number. So ideally, I think the number's right around day 4, day 5. It just depends. We have to balance out all these things, There's other issues at play, like if a tourist has to come out to Kauai and get quarantined for 4, 5, 6 days, might they choose Maui or the Big Island instead? Or how do we do this extra testing and not steal from the resources of the people of this island, right? Like if we're testing 500 tourists a day, that's a lot of tests we're utilizing. So I think the mayor and some prior meetings had said, well, let's do this, but with testing that's pulled from a third party and not from the ones we have here.
No, I'm not sure if you saw the mayor's daily report today.
No, I understand he's making a movement in this direction, though. Yeah.
Well, yeah, he because the governor, and to Derek's credit, he had actually requested this testing for quite a while, and the governor just not responded. But today he made it very clear, because some of the state state officials were saying that they cannot approve this because it's going to tap into the resources of the state, the testing capacity. But Derek had already secured. He says he's already purchased 15,000 test kits, and they are working with, again, getting a third-party provider, so it would not impact the state's capacity at all. So there is really no reason to say no.
I can't imagine a reason. And if you think about the resource that's most important for the people of Kauai, it's not testing our people that have a cough or a sore throat. It's stopping the influx of this, right? So there's no question in my mind that it's more intelligent to be screening these people in an intelligent way that's been thought through in a way that's not kind of dictated by the tourism authority or the hotels or the economy that's literally, collapsing in front of us, to kind of Great Depression era type things. But
and you're not alone, Doc.
A stitch in time saves 9. An ounce of prevention is worth a pound of cure.
Yeah.
Keeping these people off our island has to be the tantamount importance right now. And I think there's going to be, like the Buddhists say, the middle path somewhere in there. Maybe day 3 or day 4 testing cuts it down from, a sieve to a trickle. And maybe enough people are dissuaded from coming out that we don't have 1,000 visitors a day like we've had in the past, but maybe a couple hundred. And I think if we, kind of the way FDR did after the Great Depression, like he tried things and, dig some ditches over here, build a dam over here, and pick up some trash. If things aren't working, he adapted and changed. And I think we can do that in real time. And I do agree. I think the fact that he bought 15,000 tests and he's sitting on them, I mean, that's just really proactive. And this guy's been doing a great job leading us, I think, in my opinion, the little bit of politics I follow. So really my hands off to him, and my hands off, that makes no sense. My hat off to him, and my hat off to and my hat off to this group of people that I'm meeting and proposing this really brilliant proposal they've come up with. I just think when I put this thing out there, I mean, I got a call from you, which was great, thanks, or at least from Donna at DLS Labs. And then I got a call from Dr. Bob Wiener, who I've worked with for 18 years, surgeon out here, kind of took care of hospice for a while. And he kind of walked me through some of the things he's been walking through. And it seems like in his efforts in this COVID-19 panel discussion led by these 6 or 7 doctors plus some politicians and stuff, they just kind of keep coming against these difficulties, like, well, we need different testing, or who's going to do all the testing, or are we going to have a quarantine hotel, or what? And I think the point would be, the main thing I'd want to get across is let's just move forward with it and do something, and not let the difficulties stop us. And maybe we don't get it right the first time, but we just got to do something to stop this, because it's risky. I mean, we're going to let in, I mean, the estimate is we're going to let in, I think, a third of infected people with a day zero kind of testing policy. For 100 infected people on those planes that are tested negative at CVS on day, a day before their flight, for 100 of those infected people, 32 we're gonna sneak in the state or into Kauai. And if you're assuming like a 1% infection rate, maybe 10,000 a month, that's a lot of people that are going to be coming here and getting us infected. So we just got to do something different. That's what, I guess, 30. If you imagine 300 people, the numbers are these. If you imagine 300 people arriving per day, I think we would get about 33 cases per month if we don't test on day 2, 3, or 4. And that's a lot of people. And these aren't people that are going to sit in their rooms and go surfing and kind of be somewhat socially isolated. These people are going to be, if allowed to be out of quarantine, they're going to be at, all the restaurants and at all the tourist places. And it's just it's a powder keg. I mean, and we've done such a great job, right?
We have. We have. And, Dr. Dara O'Carroll and Dr. Kapono Chong Hansen both sit on that committee, and they both have been on our show. So obviously you're not alone, Doc. I mean, we put out the call to any doctor who supports or endorses this 1-day test before arrival. I have had no takers, 0.
I mean, as we can see in the national politics, sometimes corporate interests and money and economic kind of strength kind of dictate policy. And one thing that's really great about Kauai, we saw it with a super ferry, and we saw it again with this cult up here in Wainiha, is that we actually still have some power in our kind of grassroots way, and it's just a power that's unique to where we live and to the people that make up this community. And I think this is a great opportunity for us to do that. And, I think, as we saw with that cult up there, the people can get a little feisty, and people also they have a little bit of time on their hands also. I think if we kind of don't have an intelligent policy, we're going to create some kind of discomfort for these tourists and actually shoot ourselves in the foot moving forward. I mean, can you imagine the pickets over there at the airport and at the restaurants and the hotels if we kind of have a porous kind of system in place? So I think it's going to be a win-win for everybody. It's just the devil's in the details, whether we test again on day 3, like the mayor's recommended, or day 6, like this COVID task force is recommending. We have to do the contact tracing. I'd like to save some time at some point just to kind of speak towards ways we can, maintain our health and stuff. But it's just a nightmare. And really, I mean, there's the resources of the COVID tests, but I mean, really think about the resources of the ICU beds and the ventilators. I mean, that's a difficult choice to make. And there's nothing within medical ethics that's going to allow us to take the ventilator from the guy from California and give it to Auntie that we've all known for 40 years, So I think we just have to stop it, and we have to do it in an intelligent way, and hopefully a way that can kind of allow some of the tourism to come back and open up that floodgate slowly, and then kind of adapt as the data comes in.
Whew.
I don't know how we're going to fill an hour. That's all I got.
Oh, no, we will. Charlie hasn't gotten started yet.
Well, let me ask you something there, Doc. With I was just looking at some numbers I tossed around because the governor made this assertion that 8,000 arrivals a day, and he said that he equated to maybe one infection in 1,000.
Mm.
Okay, so give it a 30-day. If you look at a 30-day period, we're looking at about 240 infections coming in a month, and then we're looking at maybe coming in contact with 2.8 people per infection. That's sort
Yeah.
of the rate that they come in contact with. You're just looking at those numbers. You're looking at now combined together about 600 to 700 people. So when this whole thing began, and I wanted to ask you that, when they had this uptick, I personally felt where DOH missed the boat is kind of targeting the areas that they had these outbreaks. They kind of went on this blanketed thing. We're going to blanket everybody. It's like, it's like laying napalm across a whole ridge where, the firefight is way, way up in a mountain. You don't have to burn the whole ridge. I mean, you just wasted a whole bunch of stuff, and you could have been you could have been really precise and targeted that certain area to do the testing so we could get it under control. That's
Yeah.
the thing where I'm afraid here, uh, that we have, people coming in, and today's a prime example. Same couple twice getting arrested in Honolulu. You talk about quarantines, right? They went and violated the quarantine twice.
Right.
So tell me if you get, so just say you get maybe lucky, you get 2% of people that think that way. That's how much resources it's taking to go play cat and mouse with these people.
Right. Right. Right.
So, there's this, I understand we need to open up our economy, but I think what, we've been hemming and hawing about is we can open it up, but just do it safely. I think that's the point we're trying to make. Just let us open it up safely. Don't open it up and say it's a crapshoot, because this is what's going to happen. You open it up, people all get infected, right? So now, can the economy withstand a third shutdown? A lot of economists says it can't. The second one nearly took out what, 22% of businesses on Oahu alone. I don't think they can survive a third one. It's going to be really bad.
Right.
Yeah. So these are the kind of things that kind of bothers me, and I like your approach. Let's be systematic about it. And the thing about it is, if we make a mistake, we can always rewind the clock, because anything we do now is better than what we have.
Yeah. The 14-day thing's the best, and the testing before. I feel like it's like getting a haircut. You know what I mean? Like maybe going from a 14-day quarantine to a 7-day quarantine makes the most sense. Give it a month, reassess, and maybe go down to like a 5-day quarantine. When I say a 5-day quarantine, I'm thinking like it'd be really nice to have these direct tests. So in Molokai, when we got somebody that we got to transfer over to Queens, we do a 15-minute test, and we know in 15 minutes, so we aren't exposing the whole ambulance crew. The testing now, we got about 36 hours of the current capacity, 24 to 48 hours. So if you're doing like a day 5 or day 6 test, they're out of quarantine in day 7. So if we're calling them a 7-day quarantine, a test on day 5 or day 6, that's not as bad for the tourist, and some more people will come than a 14-day quarantine, but it's not kind of going down to 0 tests after they arrive, like Mr. Ige recommends. And Kawakami's got a 3-day test, which is great, but it might be kind of, you can't put the hair back on. So to your point, you can rewind the clock, but you kind of can't either. Once the cat's out of the bag, it's out of the bag. And maybe it makes the most sense to cut it in half, reassess, and vaccines will come out. Herd immunity will establish itself on the mainland, such that those spikes will kind of downtick, and we can assume instead of a 1% infective rate, we can maybe decrease it to a 0.5% or 0.25%. And the people of this island are resilient, as proven with the past hurricanes and with the Wainiha flood and all the things that we've been through, that even before my time. I get that we want the economy to open up, but no reason to rush it, right?
Exactly.
I also see, do you remember like in late March, like how the streets and the highways were empty, and how everybody was afraid to go in anywhere to get your 6-pack of beer or whatever you need to do. Like, you treated the gas station, wherever you went, you treated it like it was poison, right? Some of my patients that drink the beers, of course, smell. No, but and now it's just, we've become jaded and we're a little blasé about it. And if something were to happen on March 28th, I think we would have been all right because we're all kind of protective. Now, people are sick of it, and I get it, and I'm guilty of the same thing. So I just don't think we can handle an outbreak of 30, 50, 100, 200 cases. I just think it's going to spread like wildfire with the way.
Well, let me kind of share this with you. If you take a look at what the lieutenant governor presented as far as the percentage of rebookings, okay, and he showed his graph. What was very interesting to note that in November, December, January, and February, the high numbers of rebookings was the islands of Maui and Kauai. Honolulu and the Big Island were down. That possibly could be attributed to the infectious rate being the lowest in the state. So what that tells me is that if we open, people start getting infected, tourists are going to be smart enough to say, hey, we're going to go to the safest spot on the planet. We're not going to go to the hottest spot. So they can either take a choice and say, okay, we'll take direct flights into Kauai, or we'll take direct flights into Maui. We're going to bypass Oahu, and we're going to bypass the Big Island. That's when that teeter-totter effect is going to start taking over now, because if infection rates go up on Kauai to the point that we can't house them properly because we're out of beds, where do we go from there? That's going to be the nightmare at that
I think
point.
what you're saying is just add up to the list of Waimea Canyon and the Pali Coast and Hanalei Bay. Let's throw on one of the lowest infection rates in COVID in the world, really. And that's going to be something that's going to draw these people in, and maybe they'll kind of stomach 7 days in a hotel a little bit better than that. I don't know. I don't know if you guys are looking at travel. Like, for my kids always like to snowboard Christmas. I'm not doing that. It's not worth the risk for me. So if you said there's a little snowboard place in, somewhere in, Sapporo, Japan or something where there's nobody infected, that's the place I'm lining up, and they're going to sell out their hotels. And if I got to sit in a hotel for a week before I can go ski, I mean, I don't have that much time off, of course, but I think you're totally right. And I think it's smart to take advantage of this resource that we have, which is no infections, really. I mean, I guess
what I was trying to get to is that if we do open up and the infections climb up, and it's not, that alone will be a discouraging point for anybody to come here.
Exactly.
And we're trying to tell them to do it right so we can balance it right. You cannot be selling Hawaii to the point where if we're not controlling the infections properly, because we already proven we couldn't do it the first time.
Right.
I don't know. You got a magic crystal ball that's telling you that you're going to do it right this time. I don't know, but it remains to be seen. That means that it'll be telling a lot of folks, well, here we go. Just like Florida, right? Places like the sun, sea, surf. What happened? The rates go right back up. Nobody wants to go there now. So they're looking for other places. And that's going to be at the demise of, the authorities that handle the tourism. Those are the kind of things that they should be looking at.
Well, and again, while it would be nice to support tourism and to keep it up, even more important than that, of course, we would all agree, is the safety of the people that live here. And it's really that simple. So if we can keep the tourism up a little bit, a little bit of injection into the economy, but not too much at once. Think of all the people that'll lose their unemployment checks. We got to kind of go. We got to go slow.
That's the thing. I think what these guys aren't, and I know they're aware of it. They're just not using it in the formula to make their decisions. Is we got 11 ICU beds on Kauai. We got 15 ventilators on Kauai.
Yeah.
We cannot afford to slip. We cannot afford to screw up. That's the thing. We're not Florida. We're not anywhere else where you can zoom people in a helicopter or in an ambulance, go to a neighboring. No, we're done. This is it. This is all we got.
Yeah.
And if tourism jumps, and it will, we know it will, we face some dire consequences where people will die. And there's no reason why we cannot do both. there's no reason why we cannot gradually open up while making sure that the people are safe. And the direction that they're taking takes very little into account as it relates to the health and safety, the capacity, the medical capacity
Yeah.
of the outer islands like Kauai and of course Molokai. My gosh.
Well, I can speak towards that. I mean, in Molokai, often I'll have a patient that needs to be transferred for whatever reason. You know, they need a surgery or they have a collapsed lung or fluid around their heart or a 20-week baby that's coming out and we got to get them somewhere. And you'll call and Queens is full and then Straub is full and Castle's full. And you're stuck there with limited resources. And actually one case, one of the things that sparked us to get a helicopter service from Maui was one deer patient who was, you know, they kind of grow them big sometimes over in Molokai. He was a little bit too big to fit on the fixed wing. So we had to call in a Coast Guard C-130, which is a troop mover. It can fit like 2 Humvees and 90 troops. So we had one of those come over, but it took us 12 hours to mobilize this. It took me 12 hours to mobilize it. And that was back when we didn't have a ventilator. So we were bagging and masking this guy for 12 hours. And, you know, we were all so relieved when we got him out of there. And then when we got the call from the tarmac at the airport that he coded and he died and they brought him back, he didn't make it. And that was a perfect example of a man who died because of the limited resources that we had at the time. And, you know, that's one person, right? That's a number one on a list. And we're looking at these numbers of, I don't even know the numbers, 1.8 million infected and 150,000 dead. I don't even know the numbers, but each number is a human, and each human has a family and a network around them, and an ohana that is, you know, seemingly infinite here on this island. We can't afford to lose one person.
Doc, Charlie's brother passed away from COVID in New York early on, back in March, I guess it was. So, you know, you're right, man. It goes beyond the number. It goes way beyond the number, especially here, like you said. Doc, I have a question because this was posted. Someone posted, they posted a comment that I want to get your thoughts on because it's kind of concerning. It says, "It's all about age. My friends at the hospital have already warned me if needed and I was sick, they'll pull my vent because I'm over 60 years old."
I don't know anywhere where those kinds of policies are happening. I can't imagine a vent being taken from somebody. The mortality rate definitely increases as you get older. I think greater than 80, you got like a 15% chance of death, and it goes down from there. 60 to 69 is like 4%. 50 years old to 59, which in my opinion isn't old. I used to think it was old.
No, hell no.
It's a 1% risk of death. And, you know, more than that, there's all these kind of chronic conditions that can follow. I can't imagine somebody taking a ventilator from one person to give it to another. But you know, when we're trained in kind of triage scenarios where like a big bomb goes off or something, and we're going around triaging 10 victims at once, we are trained to look at the ones that don't look like they're going to make it. You know, the ones that have 80% of their body surface burned, or the ones that are laying there flat. We might go deal with like a pelvis or a femur fracture before the guy that looks kind of half dead because of the chance of survival. I really pray that we'll never get to that point where we're taking vents off of one person and putting on another. There are other ways to do it besides ventilators, of course. There's BiPAP machines, and there's putting people prone or laying face down. But you know, there's certainly no miracle drug, you know, like some people have advocated for. I don't think that's going to happen. I hope that doesn't happen. I think what would probably likely happen would to that person in the ER that's really sick, or the one on the floor who for 3 or 4 days is pretty sick, but on day 5 needs to get intubated. I think the hospitalist crew, which is a great team we have here, would kind of call around Oahu the way I call from Molokai and try to find a bed with a ventilator for that person.
Wow. That, you know, that again, the biggest concern, like you live it in Molokai, you have very limited resources there, and Honolulu, we saw it with the last surge. We didn't have, the quarantine was still up, the lockdown was still going. We had the clusters on Oahu. We were at, I don't know, 5 or 6 of the hospitals were closed because they were full.
Right.
They were transferring patients out of Queens and over to Waihewa, and we didn't even have visitors. I mean, that to me, that was an exercise for us to make us understand that we got to be very careful, because it doesn't take much to wipe out our resources.
It's
What,
right.
what are your thoughts? I mean, what would we do? Let's say, what happens, Doc, if in the last case, let's say we had another surge of 300-400 more cases, which is typically what we'll get with the tourism. What happens?
Well,
what happens?
I mean, I don't know what would happen if we kind of hit the like 10% infection rates, like New York, or 5% or 10%. I don't think there's a scenario there that wouldn't be terrible and terrifying. I think worst case scenario, I don't know how many people live here now, 60, 70,000. Is that about right?
Kauai, yeah, 72,
74.
72,000.
Okay, so
74,000.
70,000. Any one time, I've heard we've had up to like 10,000 tourists back when we're really flowing. Is that about right?
Actually 25,000 a day.
Jeez. Okay, so let's just call it 100,000 people on this island. If 1% are infected, that's what, 1,000 people. And if 5% of those, 10% of those, let's say even 10% of those people are really sick, that's 100 people. There's no way. I mean, that might be a high number. There's no way 1 or 2 ER doctors down there at Wilcox and 1 hospitalist and 1 ICU room. There's no way to handle that many people. I can't even begin to imagine.
Not to mention the strokes and the heart attacks and the surgeries and the car accidents and all of these other things that go on in normal life, where you got to use the hospital. You got to use the hospital bed. And
well, remember, it's not just dying of pneumonia, but this virus causes heart attacks, and this virus causes strokes. And more, as important perhaps as mortality, I mean, there's a lot of chronic conditions that occur. I think in one study of hospitalized patients with coronavirus, like 30 days, 45 days out, 70% of them had 75% of them had abnormal pulmonary function tests, right? I think 25% of these people are getting, infection in the heart and a worsening function of the heart. So I understand. I want to speak towards the young people, if anybody's on a Friday night younger than 50 listening to this. They might not die. They might be reassured by the fact that, I'm under 50, I got like a 0.4% chance of dying. But I'm in the clinic all day listening to complaints of people with a little bit of fatigue or a little bit of a headache or a little short of breath, or I can't quite surf anymore. It's amazing how we take our health for granted. And if you're not 100% optimum, that's a big deal. And if you get a 1% infection rate, 1% of the people, maybe a third of those guys are chronically for 6 months, years, not able to do lifelong, not able to do the things they wanted to do. I mean, these are really real issues. And I think hopefully people can think of this when they're deciding to get vaccinated or not, because that's a whole another can of worms. But I'll tell you, on the North Shore, I would say 50% of my kids aren't vaccinated. And I even think they did a study and asked physicians who's going to get vaccinated. And I think up to 30 or 35% of them said, I'm not going to get vaccinated. So this vaccine is not a magic bullet. They're probably going to need multiple of them. There might be, immunity might wane, which is to say run out. You might need to do it often. There might be side effects. A nurse practitioner that works with me is in a trial, and she got the second booster of her vaccine. She's an early person. And she said she got a fever, woke up with a fever of 103, couldn't move, and extreme fatigue for 2 days. And she called the people doing the research study and said, hey, this is how I'm feeling. They're all, oh, okay, well, that's to be expected. If the fever doesn't go away in 7 days, let us know. So this idea of the vaccine going to kind of come and save us, like, Richard Gere on his white horse at the end of Pretty Women. It's going to be it's not all good, man. This is a crazy virus. It's going to take us a long time to get back to normal. The economy will probably never recover, in my lay opinion, and tourism might not ever bounce back. But maybe we can get it a little bit better at a time, like that haircut. Just a little bit better at a time, and not risk the health of our people, and not risk the people visiting. And I don't know if you guys have a lot of experience with the people visiting, but they have a different expectation of certain services than we have kind of come to appreciate here. And I don't want to deal with those guys unhappy with the fact that we don't have the best medical care that they can get. You know what I mean?
We've had two COVID survivors, one from Kauai and one from Oahu, on our show. And very, very revealing shows as far as their life after COVID. Both of them were told they're not going to ever be at 100%.
Yeah.
And I think that's where, I'm sure it frustrates you like it does most of the other doctors, is how people try to compare this to the flu and to say that it's just another influenza or another virus. This one's a little different. What do you think? I mean,
well, I think like what's interesting about this is, and it's something I spend a lot of time thinking about in the clinic, is it's how extremely pro-inflammatory this virus is. It somehow turns on our own body's kind of immune system to just wreak havoc. And acutely or in the short term, inflammation is nice. It's what brings a little bit of the white blood cells to fight off a virus, or the swelling to an ankle to heal up a tendon. But chronically, inflammation is probably the single bottleneck common denominator of all disease, right? I mean, inflammation causes strokes, it causes heart attacks, it causes arthritis and migraines and lupus, it causes Alzheimer's disease and Parkinson's disease. I mean, pretty much every condition I can think of, hypertension, osteoporosis even, is an inflammatory condition. And what's interesting about COVID is it's this inflammatory storm. And when explaining this to people, I tell them it's kind of like lighting a fire. And after the storm is done, if it doesn't kill you, it scars up those little sacs in your alveoli in your lungs. It leaves damage in your heart. It messes up some blood vessels in your brain. I mean, this is stuff that you can't recover from, and it's just very unique to this virus. It's kind of akin to autoimmune disease for those people that suffer from things like rheumatoid or celiac or certain conditions. But it's a different arm of the immune system. It's a Th1 system. And we don't really know a lot about it. We have a lot of information on autoimmunity, but this autoinflammatory thing is kind of new for us. And it's just scary. It's really scary. Now, at the same time, I don't want people, I mean, there's so many people I know that are just living in extreme fear of this coronavirus. And I think that stress that they're experiencing is kind of a perfect storm for them. And it's a little bit of a self-fulfilling prophecy. I mean, stress is going to bring your immune system down. Lack of sleep is going to bring your immune system down. So I think to be intelligent, the stress is there for a reason. It's to allow us to change, right? Allow us to change our behavior. It's not something to sit and perseverate on and kind of develop anxiety and depression and social isolation. So people need to understand that the best things they can do for themselves is make smart choices, kind of support the governor and the mayor in making intelligent political choices. But so too, it's getting plenty of sleep and not stressing out and exercising and eating right, and like little zinc or a little vitamin C. Melatonin is particularly unique with this virus, that is protective. I mean, just for example, my partner in my clinic just sent me over a thing that said people that had less than 5 hours of sleep had a 450% increased risk of getting coronavirus than the people that had more than 7 hours of sleep. So just simple little things like that we can do. And that's just kind of my primary care hat coming out to talk to some people, just kind of things that they can do. But no, speaking towards your point, this disease is unique. And I mean, I fear that it's going to be the first of many, you know what I mean? I feel like this is like, the organism that is Earth kind of reacting to some of the things that maybe humanity's done and kind of finding its way to curb the population in a very esoteric and kind of all things are one kind of psychology. That might be a little too nuts to talk about right now, but I'm afraid that this is a problem that's not going away. And what's the next COVID going to be, you know, or when this thing shifts? I mean, this was SARS, 8 years ago, and now it's COVID-19 because it came out in 2019. What's COVID 2025 going to look like, you know? So developing smart policy that's not dependent or catering to economic interests and kind of the almighty dollar seems like something that makes a lot of sense. And you know, I think if the people are behind it, the people in charge and the government should listen. So, you know, what we're lacking in the national scale as far as a spokesperson towards this intelligently, I think we have on a local scale. And I really thank Derek for doing what he's done thus far. And, you know, I think there's always going to be people that say it's not enough. And there's always going to be people that say it's too much. And I certainly realize that we can't keep everybody happy.
Well, you know, from the onset, I used to show with Mel that, you know, since my brother was like the first, I think it was the first 3,000 that died in New York. And I remember when they called us, when I talked to him, and then from the second day on, I never heard anything from him. But it was because I had worked after my police career, I worked in the medical examiner's office in Honolulu. So I kind of knew a lot of the jargon that was being sent our way. And when they said that they were going to dialyze him 24 hours, I immediately said, wait a minute, you're going to do what? And they said, yeah, but now we're having problems. I go, what is that? He says, you know, the dialysis machines are just gunking up. The blood is just thickening so fast.
Oh.
And the thing is, that's, you know, you talk about the strokes, what they're doing is it was coagulating at a very fast rate. And so my brother had gone on when the very early stages with the hydroxychloroquine, but upon giving it to him, like within no time, his heart started to act up, and they saw that was one of the things they were worried about. So they pulled him off. They had to discontinue. And it was just, you know, after he died, it was like weeks after I got to get some glimpse of the report of his of what happened to him. And basically, his heart was just, I mean, his lungs was just like mush. It was just like mush. It got busted up so bad. So even if he made it, you hit the nail on the head. What is the quality of life?
Right.
Well, you know, what do you look forward to? I mean, we got this one kid. He's 7 weeks in a coma. Comes out, burly guy. He's on Alofa Nua on Oahu, and as big as he is, he was supposed to come on our show, but he wanted to do so when he no longer had to use an oxygen tank. It's been how many months now, right, Mel? He's still on an oxygen tank, and he don't know when he's going to get off of it. So, you know, people can say you survived this thing, but you got to delve a little bit more and ask you, okay, what's the quality of life now? Because I've got one girl, she was in a prison. She got affected with COVID. We had her on. She recovered fine. But the social side of it is because she had COVID, she's facing all kind of problems like, you know, you can't do this because you're COVID. It might come up again. And she said, wait, I got cleared now. But, you know, it's the stigma that now follows them. Yeah. So that's another aspect that nobody even talks about. Nobody even talks about.
Right. Well, Charlie, I'm so sorry to hear about the loss of your brother. I mean, there's no replacing that. I mean, and I imagine maybe part of the impetus for this interest in this show that's been going pretty much nonstop since March and mostly consistently about COVID is partly because of that.
Yep, exactly.
Yeah, well, that's a beautiful thing that came out of it, but there's nothing that's going to replace that. So I'm really sorry.
Yeah, thank you.
Charlie took us on the journey. He took us on the journey from early on, and it was heart wrenching. And then, you know, you hear when we started tonight, he just had a message from another dear friend on Oahu who was just COVID positive and now just being hospitalized. I mean, you know, it's it's far reaching. And see, that's the thing. I'm so afraid that when it affects our little island, Honolulu is big city. I mean, it's big city. Of course, when the big island, you got the Veterans Hospital. It's a bunch of local old veterans, people that went, was in the military, and we cannot take care of them. The emotional impact on the citizens gets high, and they get angry, and then they want to. That's when things happen, and I'm afraid that if we don't get a handle on this, and these visitors come in, I know you mentioned earlier about the picketing at the airport and all of that. I'm concerned that it might even get worse than that. Um, if we should, God forbid, lose a tutu or some well-known, loved one here on the island, that everybody's going to turn their anger over to the visitors. And I'm really afraid of that. And the mayor is afraid of that as well. He was on our show. He talked about that. And of course, we do not promote that. But I'm just so afraid of what can happen if we get to that point here on Kauai that our hospitals are full. Hospitals are full. And so, Doc, I know we got about 10 minutes left, but how important is it? And the reason I keep asking the same questions with the different doctors is because I think it's important the public hears it from everyone, all the experts. How important is it to wear a mask? I mean, shouldn't we all be wearing masks? Isn't that one of the easiest things for us to do to protect others?
It seems so easy. Yeah. I don't know. I haven't reviewed data on it, but it seems so easy, protecting yourself and protecting others around you. I mean, the problem with this virus, as I'm sure is spoken of before, is, you get infected by coming into contact with somebody, whether they have symptoms or not. And then maybe you start shedding virus on day 3 or day 4, and you're therefore infective, and you probably don't develop symptoms until day 6. So you just don't know when you have it. You don't know when the person at the checkout counter in front of you has it. It's just such a simple thing to do. And it's so sad it's become a political statement. It's become like a Trump or a Bernie sticker on your car in some parts of the country. I think wearing a mask makes a lot of sense. And it's the bare minimum. And I also think if we do start having viruses on this island, I think having some alcohol on you and just imagining anything you've touched could potentially be contagious is probably the best thing you can do.
This is what I'm gonna do.
Or
anything 80 proof or higher.
This is what I'm looking into as a side business. I'm gonna develop a mask, because if you talk about spreading, we're talking about droplets, right? Anytime you talk droplets, right?
Right.
I'm gonna invent a mask that has actually a blower that blows that way. So when I'm talking to you, it's gonna start already blowing your droplets back at you. Not gonna even get near me.
Right, like a little hat with a bunch of fans that just are blowing out. Yeah. I'm afraid the person with the biggest fan is going to win, unfortunately.
Yep. One of the things I noticed, and I'm not sure what it's like out on the North Shore because I don't go out there much, but for the most part, everyone here in Kauai wears the mask. I mean, I see lots of people wearing masks. There was a huge bodyboarding or body surfing competition out in Poipu a month or so ago. It was a statewide. It was huge.
Yeah.
So my wife and I went and took a drive down there, and I was very surprised as I drove down that road. 90%, 85, 90% of the people were in masks. It was a good thing to see because people take it serious, and nobody wants to get sick.
I think the difference here is part of it's I don't want to get sick myself, but I think the difference here is we're really connected to our community here in a way that nobody else understands. When I first got here from California, and some car on the highway would stop and wave me in, not just some car, but the first car that was coming. Like, people are looking out for each other here in a way, because I think maybe they've all gone through it and fed their neighbors during the hurricanes, or I don't know, but I think here there's a sense of we're all in this together. We're out here in the middle of the islands, in the middle of the Pacific, and we're all in this together. And if it's my little part to kind of protect you, I'm willing to do it. and I'm going to wear that on my sleeve, that I'm here being a part of the solution. And I think it's the most beautiful thing about this place, really. I really think it's a unique thing. And again, I think it's just such a simple thing to do. I mean, why not? What's it's not that bad, and we're all getting kind of used to it, you know.
You know
I
what's
don't
going
know
to be
when it's going to go back to normal. I think
what's
all our
going,
ears are going to evolve to kind of be sticking out because of all the pressure on them. Like the kids' thumbs are going to get bigger from texting.
you know what's going to be really unique is to gather the data this flu season, because everybody's wearing a mask,
Yeah.
to see how much it's driven down, because
yeah.
that's going to be the telltale factor right there, the telltale sign that if with constant mask use, if in fact, because growing up catching a plane back in the old days, it wasn't like when we had TSA. You get on the airline, you fly from Oahu to Kauai, and as the years went by, even in the police department, when we would extradite prisoners, we would always have one or two Japanese get on the plane,
Right.
and we couldn't understand these guys wearing masks. And what the hell? Now that's way back in the 80s, the 70s. They were onto something way before all of us were onto something.
Right.
And it's proven. And it's proven.
Right. Right.
So,
I think it's going to be interesting to see. I totally agree. I think flu numbers are going to go way down. I'm curious if there might be a downside. Like I'm curious if there might be something advantageous for us spreading the common colds and us sampling the kind of current bacteria and viruses in the environment constantly, so our immune systems can kind of become more intelligent. I wonder if there's going to be a downside to social distancing, such that next time, almost like a 2-year-old, when he gets a virus, he spikes like a 103 or a 104 fever because the thermostat of his immune system isn't quite set. I don't know the last time I haven't had a 104 fever since I was probably 3. So I think there's probably an advantage to us kind of sharing little viruses and kind of getting a little bit sick here and there. And I wonder if there's a danger to not getting sick. That being said, I don't want to get coronavirus.
no, you're right. You're right.
I don't want to get the flu. I definitely don't want to get the coronavirus.
When this virus first started, I was so upset, and I put a post. I said, if I see the next son of a bitch eating one bat, I will go after you. Because of how this damn thing started. I said, man, somebody would, why couldn't you just settle for a damn hot dog or a hamburger? You just had to go for a bat, and look what the hell happened. Damn it.
Well, I mean, I think I didn't follow too carefully, but I think these wet markets that are putting species together that have never been meant to be together, this planet has kind of come together in a very slow and steady way, right? I think we should follow nature and the wisdom of nature in such things as opening up our island to tourism, and maybe go in a slow and steady way. And it's been successful at 14 days, and people are saying that's too stringent. Let's loosen it up. To go the opposite way in that thermostat example is like blasting the heat after being somewhat comfortable for a while. And
this
for those
is what happened
on Kauai, that's kind of like a lot of ovens open at once for Kauaian heat. But I mean, I think maybe shaving it off a little bit, like a 7-day quarantine with a day 6 test, makes a hell of a lot of sense. And reassess in a couple months. And I'm glad that Derek Kawakami has kind of come up with this, at least give us a 72-hour plan. And maybe even with that, with the compromise that is politics and the polarity these days, maybe that's not even going to fly. But really, I would like to see a slightly longer one. I mean, the data that this COVID interest group has kind of presented, just to kind of go over quickly, which has already been done. But I think out of 10,000 people, which is a legitimate amount of numbers to come in a month, I think on Kauai, assuming like 400 people per day, at the current thing of testing, just only having a one test system, 33 per month are going to slip through the cracks.
Yep.
If we did a day 4 test, they think maybe 13 visitors will kind of slip through the cracks. And if they do a day 6, 4 per month, not per day, will slip through the cracks. So the sweet spot becomes day 4, day 5, and even day 6. Yeah, that's what I was talking about. I think.
Yeah, we had this group on our show, and to me, this was the kicker. If I can find it, it's down here somewhere. Um,
Yeah, it's even farther down. That
there,
one right there.
yeah,
So that's assuming 1% infection rate, and that's assuming per 10,000 arrivals, that would be about 333 tourists arriving per day. So I think people are estimating 1,000 visitors a day, but let's just keep it round numbers. If 300 people are arriving a day, which I think is that one airplane, maybe 2 airplanes a day.
yeah, I would say one airplane would probably bring you about 200 passengers.
All right, so
Yeah,
we get 2 airplanes a day. That's 32 people per month with Mr. Ige's proposal, and it's 18 people per month positive COVID on this island with Mr. Kawakami's proposal, and it's 5 new cases per month with this interest group's proposal. So those are real numbers, and I mean, if those 18 people are going to whatever, restaurants and hotels and Spouting Horn and everywhere else, and worse than that, if they're coming with a mentality that's if I wear a mask, then that means I'm a card-carrying liberal communist, and they're not wearing their masks, I mean, it's just a dangerous situation. Again, these people are exposing the community and the people that work in the tourism industry 2 or 3 days before they get symptoms, if they get symptoms at all. So it's just a perfect storm. We got to lock it down, and I think a 2-test system is the only way to go. And it's just a matter of shaving hairs, how many days we wait.
yeah, I think politically, I know the discussion group had met with the lieutenant governor, had met with the Department of Health. They made it very clear. Like I said, we've had them on the show. They explained this process. The 6-day would have been ideal. Derek is probably not even going to get an approval on a 3-day, and it's a shame.
You know what? I don't. You might know things I don't know, but I still maintain hope. I hope we can get this through. I mean, I don't know why. And that was what that letter was. It was like, hey, anything I can do. Not that I have the resources, but the feedback you're getting on this show and how many people are watching, the amount of people that are kind of giving me thumbs ups and stuff for the quick little letter I wrote. The community is completely behind this.
Absolutely.
And I think Mr. Kawakami needs to realize that. And I don't know what legally he can do outside of Mr. Ige approving this. I don't know what we can do. But I have faith that he's going to fight the fight for the people, because he's demonstrated that, I think, in the past. And I hope we get it through. I agree. 3-day thing.
We're going to find out. He's on our show on Monday. He'll be on our show on Monday night to tell us what his plans are going forward. Hopefully we get an answer by the governor by then. But it'll be an interesting show to hear from him of what the heck is going on.
Well, I thank you for inviting me. I'm gonna have to buy a Mel and Charlie T-shirt. I might have to start listening to the show.
I did want to say that to me, a lot of the fault lies where when you have the opportunity to learn, the state didn't capitalize on that, because you figure from March to September, there was a period, like you said, when the roads are clear and everything was on a downturn. To me, that would have been the opportune time to start revamping the plans, because we have basically the clock stopped. We put everything on freeze. It gave us real time to revamp the plans, and then when we start up again, let's try it. Let's do a rollout gradually, right? They didn't even do that, because every single time we confronted a situation to whoever, they always say, well, this thing caught us by surprise. Well, I'm sorry, because, and I kind of gave the thumbs up to Dr. Libby Char, because when I was at the ME's office, we did mass planning in case we had something really huge. And I sat on that committee with them, and we had a lot of planning back then. And I just didn't understand when this pandemic first hit, it just didn't roll out like how we planned. And this was back in 96, 97. It just didn't roll out. So I'm just wondering, how can you tell me you didn't have a plan. I know you folks had a plan, unless you guys put it in file 13, which was way downstairs in a basement somewhere, and you didn't want to go find it. And, it's just upsetting. It's upsetting to know that because if look at what the military has, right? Biological, chemical warfare. They have a plan. The recipe is just like any recipe you use for any type of gravies. You start with a basic gravy, you add a little this, a little that, you make a brown gravy, you make something else, right? We had the basic plan to start from and move from there. They didn't even roll that out. So I had a really hard time accepting the fact that, well, we were prepared, but not that prepared. I said no.
There was a lot of shutdown, but not preparation for the opening. And I feel like we've used luck and this extreme closure to feel like some false confidence in our success. But it's not like we went out and bought a bunch of new ventilators. It's not like we amassed a ton of testing. It's not like we developed contact tracing teams. I agree. I think there's an opportunity to learn here. And unfortunately, people learn from their mistakes and they don't learn from other people's mistakes. Raising a teenage son right now, I can speak towards that. So unfortunately, the fact that Mr. Trump has COVID right now, I wish him well. But maybe if he gets pretty sick, it'll change people's minds, and I fear for the opposite too. If he doesn't get sick and it's just a bad flu, it'll just kind of give all those people a little bit more fodder to say, you guys are all overreacting and shutting down the economy. Just in case anybody's listening is going to vote on November, I wanted to make my point clear.
Well,
I agree with you, Charlie. I think a better reaction still could be happening, and the fact that we're opening up tourism again right now, without really much having changed. And again, I realize I'm ignorant to some of the things that might have happened, but I don't know what we've done differently other than shut down and kind of patted ourselves on the backs. I don't know. I don't know why, if a Ford factory can convert in 1941 to create a B-52 bomber every 2 days, I don't know why we're still talking about shortage of testing supplies.
Exactly.
6 months later.
Bingo, right there. Bingo.
That's what troubles us. I think come on, man. We hear excuses. It baffles me how these people, they assume, I think they just thought, and they still do, that this virus is going to pass Hawaii with very little impact. And that's where I think they're wrong, because like you just said, we can learn from other places' mistakes.
Yeah.
And there were many mistakes made in this world. There were many successes in this world that we should be following the successes and learning from the mistakes. And I just don't get it, man. I don't. I worry tremendously. I'm not one that worries a lot, but this one has me worried and has me concerned enough. And we just got to keep getting the people to understand that we got to do our own individual responsibilities and wear our masks and social distance and wash our hands and do all of that stuff, because we're not gonna be able to stop the train. I have hope like you, Doc, with all of our viewers. I don't know how many emails got sent to the Capitol. I'm assuming probably close to 1,000 already went just from our little group, but there's many more. Maybe we can get him to change his mind, but we cannot stop. We cannot stop until October 15th. We got to go until D-Day, and hopefully he comes to his senses and say, hey, maybe we can hold off. Maybe let's go try Kauai, do the second test on Kauai. Let's do a little pilot project, which is what Derek wants to do. And he's prepared to do it without any impact to state resources. So there is really no practical, reasonable reason for this governor to tell our mayor no.
I totally agree.
And we'll see how it goes. So anyway, Doc, we've taken up a lot of your time. Thank you so much. I'm watching all
pleasure. I've written a couple things about coronavirus in a uniquely kind of medical perspective. It's not data. It's just kind of more fun. It's at my website, steverogoff.com. If anybody wants to see some
I
fiction.
didn't know you had, steverogoff.com.
Not really, yes, ROGOFF. It's not really doctor talk. It's more like fiction. And anyway, it'd be fun for people to check out. But I think one of the things I wrote once was when the numbers become names. I think one fatality on this island is one too many, as Charlie knows. And
Oh.
I don't think we can hide behind these numbers of like, oh, only 10% of people die, or it's just knocking out the old folks' homes and the rest of us are going to be fine. I think we really need to aim for, let's be successful in a year from now and 2 years from now, be able to say, you know what, we didn't have anybody on this island die from coronavirus. Let that be our aim, and not let's kind of bring back tourism in an intelligent way. So Hyatt and the rental car companies and, you know, the people that have kind of, hey, people live fat for a long time off of tourism on this island. They can live a little skinny, I think, for a while. I mean, hopefully, you know, the resources of this island have been tapped for some financial gains from a relatively few. And I don't think they should be dictating policy right now. They should be sitting back and be thankful for the spoils they've enjoyed.
Thank you so much. Charlie, any closing comments for the doc before we head out?
Well, as always, like to say thank you for joining us tonight. You know, I wanted to bring up one real quick thing, and that is when we talked about hospital beds and prioritizing. I know it all too well. In 2012, when I had open heart surgery, I thank God that when I came out of that surgery, I had a bed. And at that very same night on the island of Oahu, there was a multi 6-car fatality. And they were bringing in guys, you know, they're rerouting them but in the ICU unit when I was recovering, there was like 3 of them injured in the hallways because there were no beds because I had taken up one because I had just come out of surgery. But just imagine if I came out of surgery maybe an hour after that, I would probably be in that hallway. So I know the feeling. I know the feeling, guys. So, like I said, you know, I want to say thank you very much, Doc. To our viewers out there, again, the whole purpose is to inform and educate. And we got a different perspective, a really good perspective on what we can do and what we can look forward to and how we can really mitigate all the negative stuff and try to turn it into a positive so that we here on Kauai can be the leaders throughout this entire state as being the ones that successfully beat the crap out of COVID.
Hallelujah.
Amen. Thanks, Doc. Hey, Steve Rogoff, SteveRogoff.com. I posted it in the comments. Go ahead and check it out. Thanks, Doc. I just wanted to say one thing. I know we talked about why Kauai is a little different. I'm going to say it. You know, in all my years of politics, I often got criticized for having a plantation mentality, that I needed to get rid of my plantation mentality. And I'll tell you, the secret to Kauai is the plantation mentality. And for those of you that were not here during the plantation mentality, where every house had a garden, every house had a fruit tree, every house had, you could go to your neighbors and your neighbors you would never starve in a plantation mentality. You would never have to worry about, oh my God, I forgot to stop at the store. You never had to worry. You just go next door, your neighbor would get it for you. If you needed a orange or a avocado or a mango, you could walk right in and go get the mango. That was a plantation mentality. And I think that's what separates us apart. So for those of you that think we need to get rid of the plantation mentality, think again. That plantation mentality kept us together, kept us caring about each other because we had to live with each other. We had Chinese camp, Filipino camp, Portuguese camp, Japanese camp, but we all came together and was able to share everything so no one starved.
Yeah.
And that is why Kauai is different. Plantation mentality is a good thing. And again, I took a lot of criticism. That's your problem. You got to get rid of that. No, we don't. We all need to get that mentality back so we can once again help each other live together and survive this crazy time. So anyway,
Right on, Mel.
thank you guys. Tomorrow night, we're trying to get Donna Mercado Kim, Senator Mercado Kim. She didn't respond yet, so I'm hoping that she's willing to come on.
No, you hoping that Egan never get to her. That's what you're hoping.
Yeah. Political careers are damaged after they come on our show. Not medical. No, you guys get elevated, Doc. You guys get elevated. But Monday night, Derek Kawakami will be on. It'll be an exciting show. But anyway, hang out tomorrow night. We will be back 7 o'clock. Make sure you guys join us. Take care, Doc. Thank you. God bless. And stay safe. We love you guys.
Aloha, guys. Thanks for watching.